Hi, Paula. There was a natural lull, so I thought we would do a quick round of introductions in the room and then get started. Are you good with that?
Sounds great.
Everyone can hear Paula? Yeah. Okay. Well, you know me. I'm going to pass it to our lovely host behind me, Courtney. Will you go first?
Sure. I'm Courtney. But Gina was trying to get me to get involved because my educational background.
Did you hear that? Environmental studies, sustainable food systems.
Courtney, I don't want to, and maybe everyone does, but I don't ever assume that everyone knows what Task Club does.
Oh,
Could you just give us a?
yeah. So Task Club is a part of community mental health, and we are a rehabilitation therapy. So people come in and they just do work order tasks, we make lunch, just like tasks that some people find difficult to do in the art. So whether it's depression or
Liv?
Hi, Paula. We've met before online, but I'm Liv Rollinger, a Core AmeriCorps service member with Groundwork. And I'm in Pellston and Lansing this year. Hi, I'm Lauren. I'm the other food education service member for Boyne Falls and East Florida.
I'm from Pregnant. I'm a grocery store for school and farm lines. Those are predators.
I'm Paula, Joe Van Holstein, and I chair TV with Wani, which is a fraternity farm located in Cart Lake. I'm also the food distribution program director for the tribe as well, and I wear many other hats. But I'll let Larry take
that. I'm Larry Dyer. I live in Petoskey. I've just been involved with local food lines since we started. And, I'm passionate about sustainable food and ecology.
Hello, everybody online. I'm Wendy Whelan with MSC Extension, MSC Private Center. And yes, I'm happy to be gathering with these folks, eating great food and trying to make sure more of our community members will eat great food for a number of years. We are counting up. So great to see you.
Hello, I am Angie Ross. I'm now with the Northern Lakes Economic Alliance, and I sat with this group years ago, at some point, and just happy to, still be in connection with some of you and meet some new folks, new to me. So at the Economic Alliance, we're just trying to be sure to work with all the industries and, keep communication going both ways and be of support. And then I was just going to share, I live in Cart Lake and have someone in Pellston School. So it's good to meet you. I always meet the person doing it, but I haven't met you yet. So I am a sixth grader.
I'm a sixth grader.
So we'll talk later.
Yeah,
So thank you, Wendy, and thank you all for having me.
My name is Nina Theron. I am a registered dietitian nutritionist with full practice in the area, and really excited to hear more about culinary medicine, which I'm so excited that to hear what Paula has to present tonight.
Hello, I'm Chris Scott. I'm an RN. I am the health services director at the senior center here in Petoskey. So I've been part of the group for a while, and then I kind of COVID hit and things changed, but I'm always interested in health and food and seniors.
And I'm Jen Scopp, and I'm with the Groundwork Center, and invited Paula here tonight because the Local Food Alliance has been, after we reconvened after many months of a COVID break, we've been wondering what our role is in the community. And so, yes.
Should we let a few folks?
Yes.
By Zoom, introduce
Yes,
themselves
I want to do that too. So
before you get into.
I see several folks that are here, Lynn and Stephanie, Scott, Kathy/Dave Covey, and Charla. Do you want to just jump in and introduce yourselves popcorn style?
Hi, I'm Scott Smith. I'm a longtime member of the Local Food Alliance. Glad to be here.
And I'm Dave Covio, Covio Scenic Farm Market here in Petoskey. Just glad to be a participant here and to learn, and a member of the Local Food Alliance as well. Great to be listening in.
Good evening. I'm Charlotte Gordon, registered dietitian working with the Little Traverse Bay Bands.
Hi, I'm Stephanie Prahl. I'm from Groundwork. I'm based out of Traverse City, and my position is development specialist. And so just really excited to be able to learn a little bit more on your initiatives and start to be able to connect with our Petoskey friends. Thank you.
I'm Lynn DeMore with the health department and have been involved, I think, for about 6 or 7 years now with the Local Food Alliance. And I work in our community health division, so work on a lot of projects that involve food and food access. So I'm happy to see so many people here tonight.
Is there anyone else online that would like to introduce themselves other than Paula, who will give us a quick bio before she starts? Okay. Well, as I was saying, we, as the Local Food Alliance, have been exploring what our role is in the community. And a lot of the things that we thought about the last 8 or 9 years have been coming to fruition. And so we're exploring new topics and things that we can get behind in terms of advocacy and community development. And so one of the things that we would like to know more about and what it means for our community is food and culinary medicine. And so for our first part of the conversation, we invited Paula Martin from the Groundwork Center for Resilient Communities to just give a brief overview of, I say brief, a brief overview of each individual thing. There are a lot of things that Paula has been doing in the Traverse City area that could very well be relevant to our area as well. But I do want to say that this is part of a conversation that we're starting, and we'd like to just continue to explore that. So if there are other topic areas or other pieces to the health sector and in the institutional sector that Paula is talking about, we should also entertain that. So with that, I'll hand it over to Paula so she can tell us more about what she's been up to more in the Traverse City area.
Well, thanks, Jen. Can everyone hear me okay? Great. Well, as Jen mentioned, my name is Paula Martin, and I am a registered dietitian as well. And I work at the Groundwork Center and based in Traverse City, but mostly we've been working out of our home. So I am coming to you live from my living room today. So I have been a dietitian for over 25 years. And when I started my career, I did start in long-term care. And I've slowly been moving up the life cycle. So when I transferred my life from Western Pennsylvania in Pittsburgh to Northern Michigan, I was working in a university setting. So I was working with a lot of young people. And I was directing all of their prevention programs. So not just nutrition, nutrition counseling, and primarily eating disorders. I was overseeing that program for treatment. I also oversaw sexual health, substance use and prevention, smoking cessation, sleep, and stress. So just a few topics of health promotion and prevention. And I really enjoyed that. And through my time working as a dietitian, you know, when you are seeing someone in an inpatient hospital, and you're coming to them to talk about diet, and they are having so many multiple health conditions, you know, is that really the right time? So I started to feel very passionate about getting better quality local food in people as early as we possibly can. And I started working at a gym at a YMCA, and I was working with young people. And then when I transferred to Northern Michigan, I really wanted to be, I did a year of searching, who's doing local food, who's working on food system, and it always came up MLUI and sometimes Groundwork. So I connected with Groundwork, and one of my first jobs was to help kind of look at this feasibility of doing something around culinary medicine and teaching healthcare providers about nutrition and cooking. So that's what I'm going to give to you today, just an overview of what we've been doing since what I've been working on since 2017. Groundwork started this conversation in 2014. So I want to introduce and give you an overview of culinary medicine. I abbreviate it usually CM, and some related food educational opportunities that we've done since 2017, and it goes through 2020. I will define culinary medicine as an approach which offers healthcare professionals and patients a strong foundation and food and culinary skills training. And then I'll share a little bit of preliminary findings. We did a pilot with patients in Munson family practice, and we called that Dinner with Your Doctor. And I'll share with you a little bit about how that came together and what we're finding. So as I mentioned, in 2016 is when I relocated, and I was helping Diane Connors with 10 cents a meal at that time. And then my fellowship ended with Groundwork, and I was given the opportunity to think about culinary medicine. And what we wanted to do with our program is make it a little bit unique. So there's a program in Tulane in Louisiana that is doing culinary medicine. So training healthcare providers, primarily physicians. And this is after they finish medical school and they're already practitioners. And some culinary medicine programs incorporate nutrition and cooking while a student is in medical school. And then the other program is a combination of the Culinary Institute of America and Harvard T.H. Chan School of Public Health, and that's called Healthy Kitchens, Healthy Lives. So I did some research on what these different programs entailed, and I thought that in consultation with all my colleagues at Groundwork, that we could have some pretty unique curriculum goals, really embedding the food system element, which was quite missing from these other educational programs across the United States. So I'm sure you wouldn't be surprised to learn that while medical providers are getting their standard education, while some may take up to 8 years to get their formal doctor education, they're really not getting very much nutrition science and nutrition education. So there's a lot of biochemistry, a lot of physiology, a lot of pathophysiology, so the body not functioning well. And nutrition is maybe 1 or 2 semesters, so less than 20 hours of nutrition counseling education overall. Well, thank goodness we have registered dietitians, a whole entire profession that are experts in food and nutrition science to support our doctors and our other healthcare providers. So culinary medicine really does fill this educational gap, and it focuses on practical dietary behavior changes, food knowledge, cooking skills, and it's just really helping people move the continuum to a healthier diet. And then we also consider the limitations that patients may have, right? So there's limitations about time availability, obviously financial resources and food access, and then cultural food traditions, and that's important to add in. And that's all part of any successful program should really be considering cultural food preferences. So we think of culinary medicine as an applied laboratory portion of really nutrition curriculum for either seasoned healthcare providers or new trainees as well. So for our program, we looked at local and seasonal food options. Our first conference in 2017 was a certified local food event with Taste the Local Difference, and we had 95% of the foods that we were cooking in the kitchens coming from local sources, hyper-local really. We also talked about food access, and I think we were talking about food access and screening for insecurity in 2017, and I'll share with you a little tidbit about that when we move forward. So we talked about screening patients using the Hunger Vital Sign. It's a two-question screening tool that just asks people if they're running out of food or they don't have enough food to get through the week, and that's one indication of food insecurity. We also looked at, in 2014, Munson started a prescriptions for produce program, so we learned about that. And then we also invited our food pantry partner, Father Fred, and they brought the food that they serve in their pantries or offer or distribute in their pantries, and then talked about how they are working to improve the nutrition quality of those foods. So we had food pantry participation. And then of course we wrapped in our food system more broadly. So we had farmers there talking to doctors. We went to the farmers market, and we also toured Oriana as well. So we tried to get many components of our food system as part of our training. So this is Dr. David Eisenberg. He started culinary medicine at Harvard, and he was our keynote presenter in 2017. I mentioned screening for food insecurity. He attended that session. So he gave his keynote on Friday, and then Saturday morning he stuck around and he participated in the pantry session that we talked about screening for food insecurity. And then I participated in his conference in 2019, and they were talking about screening for food insecurity. So I like to think that we had something to do with that. Dr. David Eisenberg was very pleased with what he saw, and that made us feel really happy as well. So I spent a great deal of time in 2016 preparing the curriculum for our first test out conference that we had. So we did research, and I wrote a lot of outcomes and goals. I wrote lesson plans, and I developed a whole booklet of resources that I'm happy to share with you all. We did pre and post assessment. So we asked providers who were attending the conference to assess their own behavior around cooking and eating. And then we did a post knowledge assessment with those with the same group as well. So we looked at both personal and clinical flow with patient education. And then we did a lot of cooking, food, nutrition knowledge, screening, and patient education embedded into the curriculum. For evaluation, we evaluated all the sessions. We evaluated our food system field trips, and we evaluated the hands-on cooking demonstrations as well. And then in 2017, we offered 2 additional hours of credit through the American Academy of Family Practice Physicians. And if you did how you were going to implement, if you told us and you shared with us how you were going to implement this new knowledge, we gave you 2 more credits. So we had a couple of medical doctors that participated that way. The one thing that we worked really hard on was identifying faculty. And we thought about broad connections between food, farming, nutrition, and healthcare providers. So we had everybody from the farm market manager as a faculty to our physicians, and of course, registered dietitians were at the forefront. In 2017, we evaluated our sessions, and we had over 18 hours of continuing medical education. That's what CME stands for. And we did that over 2 days, and we had 60 participants in that first 2017 educational offering. 100% of our participants would recommend, they were in agreement that they would recommend our conference to a colleague. And if there was no conflict of time or schedule, that's 100% agreement. Overall, we had an affirmative response that the conference exceeded or met or exceeded expectations. So 98.3% of our participants rated our conference as either excellent or good, and 69% of the conference participants would attend the conference again. And that number jumped to 98% if scheduling was not a problem. So we had 6 providers who did the additional AASP translation to practice credit hours. And then I did a couple of phone interviews with a pediatrician and other practitioners in the Traverse City region about what their needs are and how we can help them even further. And then that brought us to some of the things we did in 2019. So we did a feasibility conference in 2017, and it turned out it was feasible and it was successful. So in 2019, we went even bigger, and we did a track of the conference. So it was still 2.5 days, and we had a track for culinary medicine, which was for healthcare providers. And then we had everybody in the community education opportunity, and you might recognize some people in the pictures when I start to show them. And then we had a track just for K-12 educators and looking at food and adverse childhood experiences, and food as a way to help support some children that might have trauma in their lives. So in 2019, we did the culinary medicine again, but we added in the farms, food and health. So there's a lovely gentleman showing us something there, if you want to, if you recognize that. So that was one of our farms, food and health sessions, and Joel is sharing some cultural, important cultural tools, cooking and processing tools. And then we also did knife skills training. So these are two young physicians learning some knife skills in the kitchen. So this just gives you a sample of what we did in 2019. But the big important part was that we really thought broadly about how we were connecting everybody. So the first day of 2019's conference, we had an expo, and that was free and open to the community. We had a lot of tables of educational materials, and then we did we were calling them tapas, short talks, and we had community members sharing their personal journeys around nutrition and food. So the top corner is a gentleman from the school district, Marshall Collins, and he's sharing his perspective as a coach and also the wellness coordinator in our school district, and how he initially was not all that thoughtful about nutrition. And then as he started coaching young athletes and then learning how that food and that mood and how the success was connected, he became more interested, and he's a great champion within the school district and farm to school. The bottom left-hand picture is a whole bunch of healthcare providers and a few chefs at Loma Farm, learning about Loma's practices, and not only just the quality of the food, but also the quality of the soil and how important that is for human health and our gut microbiome. The middle picture is we had an edible table, so people could come by and pick and graze, and we had seed packets, so that was really beautiful. And then we had cooking demos. So the top right picture is one of our colleagues at MSU Extension, and she was doing a cooking demo. And we had several cooking demos that day, as well as the little tapas talks. And then the bottom picture is Mary Kulo, who is with the Northwest Food Coalition. So again, food pantries well represented. But culinary medicine is really what the fun part is, right? So many times, if you're a healthcare provider, and several of you are, conferences are boring and they're dull and they drag on, but you really want to get those continuing credits because you need those for your licensure and your practice. But there's so much fun that happens in kitchen. It really is transformative overall. So our culinary medicine faculty, I intentionally paired a registered dietitian and a chef instructor in every single kitchen. And we had the conference at the Great Lakes Culinary Institute. So this is a professional training kitchen, and with professional chef instructors and dietitians who also had culinary skills training, but were primarily our medical nutrition therapy voice for the room. I just want to give you a quick overview of some of the sessions that we did. So we had pre-conference, regular conference, post-conference. We had a lot of activities, so much so that we know we can scale back a little bit and not dilute the activities. So one thing that I learned when I went to Napa to the Healthy Kitchens, Healthy Lives is wine is fun, and we have a lot of wonderful wine opportunities in the region. So we did a wine tour, but it was for continuing medical education credits. And what we actually learned was to understand, and healthcare providers need to screen and learn what safe drinking limits are and what not safe drinking limits are. And really, what are the recommendations around using wine for health promotion? And are we doing that? So Dr. James Fox, he's a cardiologist. He led that education session, and then we went to 3 different wineries. That was a pre-session. We also went to the tea farm, Light of Day Tea, and that farm was started by a cardiac nurse who's now full-time farmer and doing her biodynamic farming. And she offered us a wonderful session on tea, the health benefits of tea, and again, for continuing medical education credit. We had 3 kitchens that had different themes, but they were all based on our local food system. So local vegetables, worlds of flavor. Again, we had chef instructor James and dietitian chef Laura McCain in that kitchen. For each of these kitchens, we had to have like real concrete learning objectives because we wouldn't have got it approved for continuing medical education otherwise. And we got these approved through the state of Michigan licensing board for AAFP, American Academy of Family Practice Physicians. And we looked at vegetables. We always talk about vegetables first. We do a pretty good job eating fruits as Americans, but we do not so great of a job as vegetables. So vegetable forwardness is always something that we talk quite a bit about. And we have some learning objectives. Our second kitchen was about local and ancient grain techniques. So we looked at millet. We cooked with barley and quinoa. And this session, we talked a lot about the DASH diet because whole grains are a big part of the dietary approaches to stop hypertension and why dietary fibers are so important for health. And then we did a protein. And again, this was plant forward. So we did a fish, primarily a fish dish. And then we also did non-meat sources of protein. So people feel comfortable using different alternatives. So just as flavorful, but you can flip the protein or use less protein. This is good for the environment. It's good for our bodies as well. And then in addition to the hands-on cooking, we always have one research-based session. And this culinary nutrition research briefing, we talked about liver health in 2019. We talked about dietary fats in 2017. We talked quite a bit about motivational interviewing. So that's a technique when you don't have a lot of time with your patients and a way to get them thinking about behavior change in a positive, affirming way. And then we also do always a fad diet or whatever the hot topic of diets are and looking at the research. We spent a lot of time on intermittent fasting and the paleo diet this time in 2019. We also had, while we had the culinary medicine track, which was for healthcare providers, we really were intentional about mixing the audiences as much as possible. So we did have one crossover session that was the full farms, food and health, everyday folks, and the culinary medicine folks and the school teachers all mixed together. And those were sessions that were well attended as well. So we spend a lot of time thinking about the foods that we're going to serve. This conference is at the end of September, so we're still right in the bounty of our local foods. So all of our recipes met nutrition goals, but we're very light on numbers, let's say. You know, we really want whole, minimally processed, plant-forward foods, easily delicious, attainable, but we don't want to forget about nutrition. So this is our way of saying, look, we are assessing nutritional quality, but really it's about the eyes, the ears, the nose, mouth, and smell, right? So that excitingness about food and the quality and the taste. So our outcomes from 2019, nearly half of the individuals would now like to start prescribing fruit and vegetables. So that's good. And we can look for ways to fund those efforts as well. We had a lot of individuals who love this idea of a concept of a teaching kitchen, a place to refer their patients to, so they can learn the same skills that they were learning in the kitchen. So that was really quite exciting. This table shows culinary medicine training, and then the non-culinary medicine training was the farms, food and health track, just so you know. So everybody felt very strongly that the quality of the culinary medicine training was high. The location is beautiful in the Great Lakes Culinary Institute. There's lots of opportunities for networking, and the quality of the offerings were good. So overall, the culinary medicine training for healthcare providers had a lot of engagement. We hoped that we would expand. We wanted to go from 60 participants that we had in 2017 up to 90, but then we realized that our physical kitchen spaces wouldn't hold 90 participants. So we didn't actually meet our one goal that we had about getting more people in the kitchens, because for safety, we couldn't physically fit that many folks in the kitchen. We also were trying to expand our reach. So we really were hoping to get some folks from Benzie County, from Kalkaska, from Antrim, and we had mixed results getting folks there. So we really didn't meet our goals to kind of pull from a larger audience as well. The credits, the continuing medical education credits, are a very important part of this. So if you have a decision as a healthcare provider where to spend your dollars, you want to be able to get continuing medical education out of it. So that's a very important part of what we're doing. Now, we found that if you are affiliated with our primary healthcare system, Munson Healthcare, you pay little to nothing for continuing medical education. So that gave us a disadvantage because it's expensive to do culinary medicine training. So a $300 conference, well, to me, that doesn't seem like a lot, because, you know, if you go to medical conferences, they're quite expensive. But because our pool of participants were used to not paying really anything for continuing medical education, that was a challenge for us. So we really just need to continue to think about marketing and promotion and ensuring that we're getting, you know, dissemination channels throughout so we can just continue to reach people. We don't have any plans for 2022 yet. Oh no, that keeps going. I don't know how to go back. Okay, sorry about that. I don't know why that happened. Okay, so this is very important, right? The work that I do is 100% grant funded. So the Michigan Health Endowment Fund is our primary grant funder for our first 2 culinary medicine conferences. We did get a Rotary Seed grant for my time to write the curriculum, and we recycled some of the curriculum from 2017 to 2019. We changed up some things, but we could really keep a lot of the same curriculum development. And then we had to go out and get quite a few sponsors. So our lead sponsor is Munson Healthcare. And then the Great Lakes Culinary Institute is also our primary sponsor because of the space allocation. And then we really had a lot of support from our local businesses, Plant-Based, Lifestyle, TC, Fustini's, Cherry Capital Foods, Oriana. Table Health is a local medical clinic that is a alternative, more holistic medical clinic in the Grand Commons. And then Planted Cuisine, Chef Logan Call, he provided a lot of our food for us. I do want to share that we have 3 on-demand keynotes through Munson's portal. So you can watch Dr. Drew Ramsey talk about nutritional psychiatry, Dr. Geeta Maker-Clark talking about, she's a Chicago physician, how she implements culinary medicine in her practice, and she did a cooking demo with us. And Dr. Orrin Hesterman about food access programs like Double Up Food Box and the Fair Food Network. So those 3 are on Munson's portal now, and you can get CME for those. Well, even though we had a pandemic, last fall, we wrote a grant with the Michigan Health Endowment Fund to pilot a cooking intervention in a medical clinic. So that's what the Dinner with Your Doctor program was. So we had to write an IRB application, which is the Internal Review Board, because it was considered research on human subjects. So we had to get approval from Munson's Internal Review Board. And then we had to give us like who our inclusion and exclusion criteria. So what type of patients did we want in our test? And then how we were going to physically do it. So while we did the IRB application and all the planning, and then COVID happened and we delayed and we delayed. And then in October through November, believe it or not, at that time, our percent COVID positivity rate was only 3%. It's quite low. I mean, it's much higher now than it was then. So we were able to mask and socially distance, and we had our 6-week intervention. So we did plant forward and food group focused cooking. We transformed the waiting room into a little mini teaching kitchen. We used electric skillets primarily for the cooking. We had 8 participants. The overall target for those who live and work in northern Michigan. So we were targeting the patients of Munson Family Practice, and then we had some criteria around obesity, diabetes, and age range. We wanted folks to come as a partner. So if the patient was invited, we also said, and who do you live with? Would you like to bring a buddy with you? And that kind of helped get people to attend. We did a couple of things. We had all chef dietitians lead the education training, and we also focused on our local food system again. And we did a couple of different things. I would get food from the farmer's market, but then I would also go to Meijer and Aldi and specifically look for the Michigan products there to show that, you know, you can get good quality Michigan ingredients, even if you're shopping at Aldi and Meijer. We were able to, you know, the participants had to be able to stand for at least 90 minutes. So there were a couple of things like that, right? So, you know, because this was a feasibility test, we could be really, we could be very clear in what we wanted and what we didn't want to test it out to see if it would work. We did pre and post knowledge and behavior assessments, and then we evaluated, each participant evaluated just their experience overall. So because of COVID, we had to do a couple of things. We had to make the waiting room as spread out as possible. So because we had 8 participants, we ended up having 6 patients, and then a few patients brought support folks with them. And if you lived in the same household with somebody, you can be at the same cooking station. If not, you had to be separated. So we set up the cooking station. So we were only allowed to have 6 people in the waiting room at a time. And that was the COVID requirement. And then I did a couple of extra things, like portioned out all of the ingredients for the recipes. So we really usually did 1 or 2 recipes per session. We also shortened the duration of the class. We wanted the class to be 90 minutes, but we shortened it down to 1 hour. We learned that that really isn't enough time to do the cooking and the associated nutrition education that went along with it. So our feasibility study was a success. We were able to turn the waiting room into a cooking school, but we really didn't see the outcomes around nutrition and behavior change. And that there's a couple of reasons for that. One is we had less time per session. And then we also had to break up, instead of having everybody together, we did it on a Wednesday and a Thursday. And then the other intention that we weren't able to do was to sit down and eat the meal that we just created together, and then have dialogue with the physician that was going to be there. But we weren't able to do that. We had to package everything in compostable to-go containers, and they took it with them to eat. So we did miss out on that community social engagement piece, where some of that education, that nutrition knowledge just flows really easily. We used this, I have my book here. Every participant got this 6-week live your best life, and it goes through food groups: vegetables, fruit, dairy, grains, and protein. And it's really simple. You know, it really follows dietary guidelines and DASH diet principles. There's a lot of beautiful pictures of food in here, but believe it or not, there were no recipes. So the team and I came up with the recipes that we wanted to use. So week 1 was vegetables, and we made local carrots. I can share with you. So the highlights for lesson 1 were vegetables and time-saving solutions. So we made sauteed carrots and oven roasted chicken. So I made the chicken ahead of time, and then we just heated it. We did curried couscous, whole grain couscous with mixed greens. We always had a mixed green salad every class. So the participants learned how to make an easy salad dressing always at every class as well. Lesson 2 for fruit, we use fruit as a flavor enhancer. So we made that lovely, in the middle there, you can see that local peach salsa. And we used a lot of farm to freezer products. So the little bowl on the top right, those are farm to freezer carrots. And we use frozen peaches for our peach salsa. And those are tomatoes from my garden, the last little bit of tomatoes that we had at the end of September. So we made sauteed peppers, onions, and kale in quesadillas. So again, beans instead of chicken or meat. So trying to get more plant-forward meals. And then the lovely salsa. So they got to put together a quesadilla and the salsa in the class. For the protein class, we talked about using a skillet frittata. So using eggs as a breakfast, as a lunch or a dinner, how versatile eggs are and all the things you can do with eggs. And then we made some local red, purple potatoes, skillet potatoes. That was lesson 3. Lesson 4 was the dairy section. So we made these turkey meatballs, and we made Greek 2 dressings, a tzatziki with cucumber and Greek yogurt, and a yogurt-based, I'm totally spacing on the salad dressing, a yogurt-based salad dressing for the dairy section. And then lesson 5 was whole grains, and we made the, you can see the bottom, we made lettuce wraps. And those lettuce wraps had black beans and quinoa. And then we made local Michigan skillet apple crisps to go with that as a side. And then the last class was some healthy snacks. So we did energy bites with peanut butter. And you saw Dr. Rowland on the front page there. He was making his overnight oats. So what happened? Our 6 patients completed the 6-week course. So we had, once they were in, they really did a good job sticking with it. We offered a couple of incentives. So we paid for childcare for one participant, and we also paid for transportation, which was taxi vouchers. So, that probably isn't all that sustainable to continue to do that. We wanted to make sure that the clinic itself offered a tremendous amount of support, right? So without the clinic helping us determine who the patients would be, sending out the pre and post assessments, all of those things, we wouldn't be able to do it. And then of course the access. So the program participants were extremely satisfied with the program. They did not make gains in knowledge and nutrition. And I referenced that because we didn't have the dinner with your doctor piece of it at the end. And I had a couple of participants who really loved the book and some that didn't use the book at all. So we have to figure out a better way to incorporate the lessons that are in the workbook. Fruit and vegetable consumption did improve, but not to what we would consider the dietary recommendations. Participants definitely showed improved motivation towards healthier eating, and they were sharing their recipes with family members and younger, their children at home, and also older parents. Cooking behavior with whole food did improve. And we did see really positive social connections with mental health. I had a participant who told me she was missing work. She was so sad. She couldn't get out of bed, but yet she would come to this class because that's how meaningful it was for her. So that's important, that social connectedness. And I think if we go for another grant again, it might be a behavioral lifestyle grant because of that. So again, we could not do this without our support. We got significantly discounted equipment. So we bought equipment for the clinic. So the clinic can now repeat this again. They haven't been able to because of COVID, but we'll, broach that again with them to see if they want to repeat the cooking in their kitchen. And then we did get about $100 worth of staple groceries from Olsen. So that was very important. And also, I don't see it on here, but the Allen Foundation was also part of our funding source, and Munson Healthcare, as well as the Michigan Health Endowment Fund. So what's coming up next is we are going to be opening a teaching kitchen in 2022. And that's really where my efforts have been. I've been working this year with Traverse Heart and Vascular, and they have clinics throughout Northern Michigan. And we did a readiness assessment for their providers. So are their providers ready to engage in this type of culinary medicine work? And we assessed their patients and asked their patients, what kind of nutrition interventions do they want to see? And the patients really told us that they would love opportunities to cook with more local foods. So that's where this teaching kitchen concept is going to be coming in very handy. The kitchen is not built yet. We anticipate it being completed and ready for us to move in August of 22. So next month, we have invited our current partners, our Chief Medical Officer from Munson, the Director of the Culinary Institute, Great Lakes Culinary Institute, and other partners that have been working on this with us to be part of our steering committee for the teaching kitchen. So my efforts now going forward are going to be talking about how we're going to implement our teaching kitchen, what our procedures, our policy, how we're going to invite other groups to use our kitchen, what programs we want to lead, what programs we want to outsource, all of those things. So our teaching kitchen is really going to be an exciting next step for us. So I talk a lot to clinicians quite a bit. I talk to physicians and healthcare providers a lot. So I always say, what's in your clinical toolbox? What can we offer? So just by cooking yourself as a provider, you're expanding your own skills. Invest in cooking equipment. We did a virtual cooking class with the medical residents at Munson Family Practice after we completed our dinner with your doctor, right? Because we really want medical residents to get really used to just talking about food, talking about nutrition. How do you like to eat apples? I like to cut them up and I put a little lemon juice on them because, you know, I'm busy seeing patients and they get brown and they don't look as good, you know? So just having these normal conversations about food with your patients is quite important. So, you know, taste test, invite, you know, invite the extension folks in to do taste testings in your waiting room. Like, how can you just have food be more present? What kind of educational materials do you have up? I'm happy to consult with healthcare providers on potential pretty pictures of lovely farms and lovely vegetables. And then Munson Family Practice has a garden on site. So how can we get the providers to engage with that garden? There's some methods that I think about quite a bit too. So we want to offer both passive and active educational opportunities. So passive is the type of educational materials that you may be handing somebody, but what can we actively do? And hopefully at some point in the near future, we'll be able to refer to our teaching kitchen. I talked a lot about motivational interviewing, ORS, that's the acronym. So you want to use open-ended, you want to restate, and you want to summarize. So having providers get used to using these short ways to motivate their patients. Of course, join us for our next culinary medicine training. And then I always encourage providers to think about what foods you want your patient to add in. So we should start with not a deficit, but always that's great. Well, can you drink just maybe a water in between when you're drinking your other beverages that may have added sugars in them? So, you know, what do we want to add into the diet and what's important there? So I consult with a lot of different providers across the region. And again, you know, my expertise areas are culinary medicine, the type of trainings that we could look forward to for providers, how to screen for food insecurity, and then food access. We do a lot with that. And then eating disorders. So, you know, that is something that comes up, and a person struggling with eating disorders has a mental health diagnosis, of course. So we have some online resources, and I'm happy to take any questions that you may have, but that's really a kind of a broad overview of what we've been working on since 2017.
Thank you, Paula.
You're welcome.
And right on time, we have plenty of time for questions. I know there are definitely some overlaps and complements in our area as we explore topics that the Local Food Alliance might get behind up here. I know we've got the tribe at the table too, that probably has a lot to offer and give us feedback on about historical food medicine. And I know Lynn has been really interested in the motivational interviewing for especially pantry clients. So that's another thing that overlaps. So yeah, I'll just open it up to questions to Paula for the next 15 to 20 minutes. And then those of you, especially on the virtual option, we do have 15 to 20 minutes at the end of our time here before 8 to go through our Apple Crunch Day, very important, and talk about our Good Food Charter Summit that's going on today through Friday. So yes, questions first and then business.
Getting the foot in the door, Paula. That's my question.
Yeah, so the evolution happened in 2014. There was the Farms, Food and Health. It was called Food, Farms and Health at the time, that conference. And it was at the Kirkbride in the Commons. And there weren't any, there were healthcare providers, and Munson was a sponsor of that, but there weren't any continuing medical education opportunities. And then in 2016, when Dr. Daphne Miller came and she talked about pharmacology, FARM, pharmacology, then after her session, then Munson was like, oh, yeah, well, we can offer continuing medical education, 1 CME for that. So they did it in reverse. So that's when it started to occur to us, well, if we can get 1 CME for that lecture, why can't we get it for more? So cooking, the culinary piece, like the hands-on cooking piece, was pretty challenging to get the CME approved. And we had to go round and round a lot with the office in Munson that does that is physician services. So I worked very, very closely with physician services. So whoever does their professional development at the hospital. And that's who I worked with very, very closely. And we, what I learned a lot, that if you want to get credentialed providers to get continuing medical education, you have to have those credentialed providers part of your planning team. So we didn't have behavioral health specialists, even though our whole conference 2019 was around nutritional psychiatry and the brain and the gut connection. We didn't have any social workers or therapists or psychiatrists as part of our planning team, so we could not do continuing education for social workers. So I'm trying to go back now and get those done. But yeah, you just want to have your planning team, and then you have to go to the board of the medical folks who approve CME at the hospital system, so McLaren, and then they have to approve it, and then it goes to the state. There's a fee to get medical credits. So like I was able to do it for registered dietitians, and Groundwork paid the fee for the dietitian fee, and then Munson paid the fee for the doctors and the nurses and the other allied health providers. So getting that done took a year. It took a year. So
it's an interesting overlap to me. Lynn, you probably noted that too, that our farm to school work has launched in a considerable way, having connected with the professional learning people at the ISD. So kind of an interesting commonality. Other questions?
Jen, this is David Covio here on my team.
Audio sources.
I'm not sure.
David.
I'm showing unmuted, but I don't, can you hear me?
Oh, now you're good.
Is that good? Yeah.
That's good.
Well, I really enjoyed the discussion with Paul. Is an absolutely wonderful, great start. And it's great to see the CME, the credits, because I think that's the key part for me as a farmer and a farm market owner here in the Petoskey area. For me, the reward has been seeing people come into our farm market who have changed their eating habits for medical reasons and seeing just really positive improvements in their health. And I've shared a little bit before how people will come in and say, gosh, when I started eating more healthy vegetables, and these are people who kind of know how to cook, but for whatever reason have decided to actually make that change in their life and actually start eating healthier. A few of them were motivated by their physicians to say, hey, I could prescribe these medications for you, but really what you need to do is change your eating habits. And having those people come in, I can remember this lady 5-6 years ago coming and said, hey, my doctor told me to come here and sign up for your CSA program. And I was on 6 or 7 medications. I'm now down to 3. For me as a farmer, that's just really rewarding to see that people on their own maybe initiative in the end are making this conscious decision to change how they eat and are seeing positive impacts on their health. And even just last week, a lady came in, she's in her 70s, saying, I'm coming here to get my vegetables. I want to live longer, so I'm coming here to get my vegetables. I've lost over 100 pounds because of the way I've changed my diet. And we were just having this conversation in the parking lot. Again, I think there's so much we can do in our community to really encourage people to
Sorry, David.
Okay. Oh, yeah, definitely worth cutting me off. So.
Sorry. We got the gist though of the beautiful conversation in the parking lot.
Yeah, that's just great. And I think this is a great first step. And I'm really looking forward to more of this in our community and seeing what we can do to encourage more of our community to eat healthier and have healthier lives as a result of that. So yeah, wonderful to see this conversation taking place in our community.
Thank you for saying that, David, because I share with our funders why we keep the farmer so present in our work is because farmers care about health. And that's not something that our funders always connect together, but farmers care about human health. I mean, so like we have to just keep reminding our funders that. So thank you for saying that.
Paula, this is Wendy. I was curious, the metric, or maybe there were 2 from the study that wasn't the nutritional changes that maybe you were hoping for. What was the time period on that post-evaluation, post the intervention?
Yeah, so we did the the knowledge and behavior survey, we did it at week 6. So we did it 2 weeks before we started. So there was 8 weeks in between the pre and the post. And then we checked back in at the 3-month mark. And right now I'm doing the 12-month mark. So I'm going to be going back to our participants again. So that's why we have preliminary information now. So I'm going to ask them what recipes they've been using from the cooking class. They also received, I didn't share this, but we would give them one cooking piece of equipment that coincided with what they were making at every class to keep them coming. And at the end, they got their electric skillet. So I want to know if they're using any of the equipment we gave them, if they did end up reading the book, the workbook, if they shared the workbook with anybody. So I'm going to be writing up little case studies for each participant now. That's my next kind of evaluation piece, Wendy.
Thanks.
This is Lynn. I have a question. Something that really intrigued me was the readiness survey. And I thought that was really interesting. How detailed is that, or how long of a survey is it?
Yeah, I thought I had a slide on that, but I realized I don't. I shared also the recipe book with you all, so there should be that available to you in a PDF. The readiness survey was, I have a copy of it somewhere here. Okay. So For the Traverse Heart and Vascular providers, we did the 2 questions for the patients. And for the patients, we just asked, how important is it to you to make this change on a scale of 0 to 10, with 10 being extremely important? So we have a little blurb at the top of the page that says, making changes to your eating habits might be recommended for you by your doctor, you know, okay. And then how important is it that you make changes on a scale from 0 to 10? And then the second question is, how confident are you that you can make these changes based on a scale of 0 to 10? So those were, those came from the 5 communication strategies to promote self-management of chronic diseases. For the providers, excuse me, we asked the providers similar questions. How important do you think diet is to your patients? How willing are you to participate in planning of these activities? And then what types of programs, what metrics would you track for your patients? So we left that open-ended, and it mostly was what you would expect: weight, lipid profile, blood pressure, blood sugar, those types of things. So we had 5 questions for the providers, and I can share that survey with you. Here's what we asked the providers. When thinking about possible nutrition interventions, what clinical markers would you feel would be best to measure? Do you feel your patients would be motivated to engage in nutrition interventions to complement their current regime? And then what is your willingness to, and then, you know, join a meeting, help with grant writing? You know, we gave them a whole bunch of different things that would need to happen. So we did that readiness assessment this January, and I think we did it this summer. I'm not sure when we started it now, but we'll be presenting the outcomes to the Traverse Heart and Vascular providers at one of their grand rounds, one of their in-services in November. And then we're probably going to test out a prescriptions for produce with them, because that's, I think, the easiest thing for Munson to expand at this point in time. But one of the things that the providers told us is that they wanted more culinary medicine for themselves. So with the teaching kitchen, we can really get in there and look at what kind of advanced nutrition education the providers of Traverse Heart and Vascular need. And we're going to use the results of this to get more funding, obviously, for our next grant.
Always the next grant.
Always the next grant, yep.
And I know that the program, especially back in the day, has had some ripple effects up here. I know Chris got started buying a salad spinner for the senior center, and you've attended some of the Farms Food and Health conferences back in the day.
Yeah, the Kirkland Hall, I spoke at that. We were just starting our farm to senior program here at the senior center. So we did work with the health department and the community foundation here, and we did purchase salad bars for Petoskey and Harbor Springs, lots of tools, equipment and we started purchasing a lot of fresh local food. We started with David Covio and started with lettuce, something simple, then we kind of expanded on that. Now COVID's kind of changed everything for us the last couple of years. You know, it's been difficult, but we did work with David and get big fresh produce food boxes. We gave away 100 a week to seniors this last season, so it's been nice. I mean, seniors like it. Like David said, I know they go to his farm and they say, you know, I need to do this. And we hear that a lot too at the senior center when they're picking up their food, you know. They really do appreciate the fresh local food that they have access to because of like the Friendship Center working with David and that kind of thing. We're looking to do that again next year, you know, and a lot will depend on what's going on with this pandemic, but yeah, I think it's great.
That's really great to hear. I've been working I've been joining a national coalition, a Food as Medicine coalition, that is specifically looking at Meals on Wheels and medically tailored meals. So, homebound seniors getting a more appropriate meal for their disease state, not just the standard meal. So that's an area where I'd like to expand at some point in our work as well, local and medically tailored meals for seniors.
Yeah, I would love that. I think that's a really worthwhile pursuit. And yeah, we have, now it is just a standard meal. And a lot of our people are obviously diabetics and have a lot of health issues. So it's up to them to kind of sort out what they should eat, what they shouldn't eat. Those programs don't allow, and staffing doesn't allow for substitutions, or things like that. So my goal has been to just try to overall make the meal more healthy, but yeah, specific diets would be great to help people with their health conditions and that, so.
With our teaching kitchen, I hope I didn't interrupt you. With our teaching kitchen, we also hope to test out different models of reimbursement for nutrition services, right? So that's always been a huge challenge, and our food pantry folks that we work with feel that nutrition services, because they're not covered for so many disease states, there's only like 4 disease states that cover medical nutrition therapy or nutrition counseling. So we're probably going to test out different ways to get reimbursed for the work that we're doing. So one of the concepts is called shared medical appointments. So on the books, it looks like you're coming in to see your doctor, but really what's going to happen is you're going to go to the teaching kitchen and have nutrition coaching, nutrition counseling, and cooking. In theory.
Our clients need that. I mean, we see clients, they come into our foot care clinic because they have diabetes and they can't take care of their feet, or they're newly diagnosed and they really don't know much about the nutrition part of it. I don't think they're getting much teaching at the hospital, or once they're diagnosed, they'll say, now what do I do, And we've done a lot of teaching. I have a nurse that works for me in my department who is diabetic and does the foot care, and I hear her in their daily, giving nutrition counseling as best she can. She's not a dietitian, but she is a diabetic herself and a nurse. So, but people need that. They need it. They want it because they do want to improve their health. They don't like being sick.
Yeah.
Anything we can do to help that would be good.
I think we have time for 1 or 2 more questions or comments. I know this is the beginning of a conversation that will continue as we brainstorm. And I talked to Joe earlier today, I'm sure there's a lot more to talk about when it comes to the Little Traverse Bay Band's health clinic and what's going on there and what we can learn from them.
Well, and that's why I asked Charlotte to be here today.
Yeah.
We, when I say we, I mean our community health department received a grant for prescription dental. So they will be able to, write prescriptions for travel citizens to go to the local farmers market, purchase, the fresh produce from the local farms as well. But, that's something that we also have to look at too, is how do we, keep teaching them how to prepare that stuff as well. And over the pandemic, Charlotte and I have made a bunch of videos to teach people, how to use these foods, and we want to talk more about the nice skills and, delve into it a little bit deeper about cooking.
Yeah, definitely potential for overlap, shared resources. Charlotte.
Charlotte will be contacted.
Okay. And if you have anything to say now, Charlotte, feel free to unmute, but no pressure.
Well, thank you. I'm really excited about this because this is just feeding into exactly what we're planning to do. And so, Paula, I'm hoping that I can tap you as a wonderful resource to help us along the way. I love the idea of bringing the doctors in from the very beginning. So I'm taking that back tonight, and we're having a meeting within the next month about how to get this going. It'll actually start in January. So, but I think we need to go to our medical staff first. So we'll take that piece right now. So thanks a lot, Paula, and thank you for inviting me.
Thank you. Any other burning questions before we move on to Apple Crunch and Good Food Charter information?
We want to switch the order of that and do the Good Food Charter and
Sure.
crunch at the end.
Yeah. Well, first, before we launch into it, Paula, thank you so much. You make this look so easy and you jumped in effortlessly, and your work is such good work. I'm so happy that you were able to share it with our northern counties, and I'm sure there's more to come. So thank you, Paula.
Thank you. Thanks for having me. I'm happy to be a resource and just connect anytime you need or have an idea. And we'll go from there. So congratulations on starting this conversation. It'll be exciting.
Great. And those of you online, you're free to check out it might be a little bit hard to hear us as we have our business meeting, but you're also welcome to stay on and eavesdrop and participate as you can. So please feel free to do what you need to do at this point, but we'll be in touch.
Thanks, Jen.